Many of us, or at least some of us, are collecting information around our health. For example, fitness levels, pedometers, mood trackers, lots of different things. There's a range of different devices that we can all wear. The challenge is often taking this information and putting it in one place to be able to generate some useful insights and recommendations around our own health. Imagine though, fast forward to the future where maybe we're all wearing one particular chip that can actually measure all of our important health information. For example, blood chemistry levels, ECG, our activity levels, what we're actually eating, and combine this in one place. And also take our personal information, such as our detailed genetic profile, medical history, and put that in the same place. We can then combine this data to generate some very interesting information about ourselves. But if we take that to another level, where we take all of our data collectively and put it in the same place, we can generate even more useful personal insights based on specific people, very much like us, and see how susceptible we are to a range of conditions. For example, you might be susceptible to a very nasty medical condition, but actually you might be able to find out that through the right diet and exercise program, your risk is very much reduced. Or perhaps you're one of the lucky ones and you may be able to find out from this system that actually you can live a little bit, eat those cakes, saturated fat, drink alcohol, even maybe smoke a bit with a relatively low risk of anything bad happening. So at least you can make an informed choice. For me, it all sounds great, but there is a dark side to this. What happens to all the masses of data that's collected, and who looks after that? Clearly, there needs to be some very strong regulations in place. We need to make sure that we've got control over that data and we can pull it out of any system that it's in, much like taking money out of a bank account. We also need to make sure that no harm comes to us for our data being in this system. For example, being denied health or life insurance. And no matter how altruistic we are, we need to benefit from it. It's of limited use if the rest of the society benefits, but we don't personally benefit from it. And as much as possible in a big data world, we need to make sure that we remain anonymous. And finally, it needs to be inclusive. We need to include everyone who wants to be a part of this, to give them these opportunities. In our new world, there are big opportunities for all of us to generate useful health insights and manage our own well-being. But also, there are challenges, and we need to make sure that the custodians of our data are held account and make sure that whatever system is in place, that it works for us.